agenda number, not a menu either. It's an agenda. So to confirm the minutes of the previous meeting, paper A, can we have a proposer and seconder from the committee? Michael is proposing and George is seconding. Are we all in agreement? So raise your hand or thumb or whatever. So John, me. So now Councillor Hollis hasn't appeared yet, has he? So we think Councillor Hollis, who was on holiday, hasn't got back yet. It's very unlike him not to be late. So we'll just push ahead on that assumption. So item 2 is any declarations of interest. Now, if you can't think of any that you need to declare, if we come to an item, then just put your hand up. Michael's already thought of one. So what is it, Michael?
Just to say that we obviously talk about the voluntary sector today, and I am chair of the voluntary sector forum. Sorry, the Isle of Wight voluntary sector forum. Okay,
thanks for that, Michael. So as I say, if somebody thinks they've got an interest to declare, oh, Andrew. Hello, Andrew. Yeah, Andrew.
Yeah. Yes, a personal interest as a member of my family is in local authority care.
Okay, right. So if anybody else thinks of anything that they think they should declare during the course of the meeting, then just put your hand up and declare it. So we'll go on to item number 3, which is public question time. Have we had any questions? We've had no questions from members of the public. So we now go on to the substantial items, beginning with item 4, which is the impact of COVID-19 pandemic on the Isle of Wight voluntary sector. Now we've got 3 people here, sorry, from the voluntary sector. We've got Jill Kennett, we've got Joe from Health Watch, and we've got Mike Woolpit looking in. So I take it, Jill, are you going to answer this, or Mike respond to this? You need to come off mute, Jill. Jill? Yeah, that's better.
Yeah, so you've got the paper through from Mike about the voluntary sector of paper B.
Yeah, very informative.
Yeah, and I think a lot of the points that are raised in your questions are answered there. And I think the voluntary sector is very broad, isn't it? So I don't know if Mike just wants to talk through what Community Action Isle of Wight did, and then I'm happy to follow in with what we did through the hubs, or we can do it the other way around, whichever you prefer.
That'd be very good. I mean, we don't often see Mike at these meetings, so I don't think we should take the opportunity and let's hear from him, Mike.
Yeah, sure. I mean, hopefully, as you say, the paper is a snapshot. The world's moving so fast, it's already semi out of date, but hopefully it captures the moment really in terms of what voluntary and community groups have been experiencing over the last few months. In terms of the scale of demand, the scale of response, the flexibility that voluntary groups have shown in doing new things, changing the way they do things to try and maintain services as best they can despite lockdown and lots of different government rules and regs which might be preventing face-to-face service delivery. The scale of the support, I mean, hubs, obviously Jill will come on to, but that was 26 new organisations effectively. And then you've got, if you like, the traditional voluntary sector, the likes of your Age UKs and your CABs and everybody else, many of whom have been working hand in glove with the Isle of Wight Council's community cell and recovery cell and others. And for the most part, I think it's been a really excellent partnership experience. I mean, the Isle of Wight Council gave out additional grant monies to the sector. They maintained existing contractual agreements with the voluntary and community sector, maybe with a couple of tweaks here and there. They worked very closely in partnership with a number of us, and they included the new hubs in all of their sort of planning and made an effort to keep them informed all along the way. I think national guidelines around, especially around the shielded list, perhaps scuppered even better partnership working because of the issues around GDPR and what you can do and what you can't do and all that sort of thing, which perhaps prevented a few more innovative responses to helping vulnerable people identify the support that's already out there in the community for them. Things like the NHS volunteering scheme, the national one, I hasten to add, not local, was a bit of a mess, and I don't think has helped particularly in terms of the clarity that people had out there about trying to get involved in volunteering. I mean, at the height of the COVID crisis, we had more than enough volunteers on the Isle of Wight. In fact, we were struggling to basically meet all the demand that people were offering. Obviously, it ebbs and flows, and now with furlough ending, you've got challenges around levels of volunteering because a lot of people obviously have had to go back to work, and obviously a lot of the main core of volunteers who have always supported the island out there tend to be your over 60s. A lot of them obviously are still worried about shielding or certainly self-isolation to some degree, and therefore might not be doing volunteering as much moving forward, and that's going to lead us into some challenges. I mean, just by one example, community transport, we run a voluntary car service which we had to stop. We've now restarted it, but of course previously we had 50 volunteer drivers and now we've got about 15. And as appointments start to increase again and people want to get out and about more, there's a real challenge, and Age UK Good Neighbours is the same. They haven't been able to start their transport service again because of the obvious challenges about doing it safely and protecting your volunteers that you've got. I think it's just such a huge agenda, and it's just an ever-changing agenda, and the big queries, I suppose, moving forward are what's going to happen in terms of the big scale lottery funding. New schemes, hopefully new programs hopefully will be announced come October, November. I mean, at the moment the funding that's coming, which has been good, a number of local groups have managed to access it, but it's all 6-month funding, it's all short term, and obviously voluntary sector needs to get a better degree of security into their financial planning, etc. moving forward. Difficult to deliver, I know, but that's what's got to come. We've got to get back to a bit of more business as usual and not short-term funding. But if the crisis comes back to visit us again, that will be tricky. Obviously, local authority funding is being challenged in terms of all the additional demands that central government are placing on it, and whether that has a knock-on impact come next year and future budget planning, we will wait and see. In terms of fundraising, so all those events, your Wolverton Manors and your Walk the Wights and all of those sorts of things, that's a massive amount of income that will be disappearing out of the voluntary sector. Lots of trading, people who have got charity shops, etc., will have all experienced a downturn in income. Charged for services is another real area of concern, where voluntary organisations are providing services as a paid for service, whether it like at Riverside renting a room or delivering a learning disability day service through a personal budget. You've got all those different stresses and strains in terms of the finances of charities moving forward. That said, as you'd have seen in the survey that we did at the moment, most organisations are pretty confident as to the security of their organisations for at least the next sort of 6 to 9 months. You might see some challenges around capacity. Obviously, there might be some redundancies across the sector where you've got paid staff, and some challenges around volunteer capacity, as I touched on, because of the nature of the age and health of many volunteers on the island. But overall, there's still reasonable level of confidence. Obviously, if this were to drag on to another year down the line and we're still facing many of the same challenges, then I think you'd start to see some real problems for local voluntary and community organisations. But overall, I think the message is, as ever, voluntary and community groups play a fantastic role in terms of the preventative end of the spectrum, the early intervention, the community grassroots work, and we offer great value for money in doing that, and we need to carry on being a continued valued partner. And as I said, partnership working through this crisis has been by and large excellent, and long may it continue.
Thank you, Mike. You mentioned about short-term funding, and I know when Scrutiny had the meeting with yourself and other volunteer colleagues earlier in the year, that seemed to be one of the major points that was being made, that came out of that meeting, how much it affects the voluntary sector performance, and how much it costs on an administrative level to have to keep bidding on short-term contracts, and how much it distracts from delivery. And I think, am I right in thinking that adult social care had broken the mould on that, and we're looking at 3-year contracts instead of 1-year contract? Have I got that right, Mike?
Yeah, that's right. In fact, the council are trying to do 3-year with potential rollover to 5-year in a great many cases. So I think the issue is more at right here, right now. Everybody is doing short term, which you can understand. But in terms of enabling looking forward, we just need that next stage to be reached sooner rather than later, so that trustees have got time to consider how their services need to evolve, what resources they need to put in place, what changes they need to make. And obviously the more financial information you've got, the easier it is to make those kinds of decisions.
Yeah, thank you. Jill, did you want to follow on from that?
Yes.
You have to unmute.
Yeah, thank you. I think what I'd like to talk about really was about the forums that came forward and the speed at which 26 different areas actually came together and founded those forums, some within days and some within weeks. If I can just go back a bit before the pandemic hit, we were already beginning to work with West Wight, with Aspire, with Pan Together, and also Ventnor and Tony McCarthy, looking at how we could work with volunteers and how we could work across our areas to support our community. And that was so helpful, because when this did happen, we all knew each other well, and we all knew what was happening in each of the areas and sharing ideas. So that was really helpful. I think Michael set up the original community forum program, and was meeting weekly originally, wasn't it, Michael? And then went forward. Yeah. And I think I don't think I ever anticipated that people would be mobilised as quickly as they were. It was amazing. I know the sports centre was shut one day and we opened next day as a community hub, and that happened right across the island. And the number of people that came forward to volunteer was astounding. And I don't think we would have got through, particularly in the rural areas, we wouldn't have got some of those people through, particularly lockdown, if that hadn't have happened. And what we're seeing now, as things are quietening down, that relationships have been formed through that process, which have led to enduring friendships, and having a real knowledge of what we've learned is this is what we need in our community. And the people, the churches that came forward, the community groups that came forward, it was nothing I have seen mobilised that quickly and that efficiently, and in all my years working in the NHS or anywhere else. And the goodwill was astounding. But I think some of the things, I think it's like Mike Bulkett was saying about the NHS volunteers. One of the key things that we all agreed on really was that our volunteers needed to be DBS checked, because although you would never want to think that anybody would take advantage, you can never risk that isn't going to happen. And so we started to share protocols across all of our hubs, so that we didn't have to keep reinventing the wheel, and everybody was working very much in a similar fashion. And down in Bembridge, you have one lady taking this all forward. In Newport and Ryde and the bigger centres, you had a lot more people, but everybody seemed to be working to the same pattern. And that really, really surprised me, because the Isle of Wight, for all that it's small, can be quite, the different areas of the island are very different from one another. But what we saw was a community, island community, that absolutely came together to support those people who needed it at the time. And I guess what we need to think about next is, if we do have a resurgence, and if you listen to what they're saying on the radio and in the papers, the GPs are very much thinking that we will get a second wave. I think everything we've learnt this time round will help us when and if, hopefully not, that happens. So I think it's been a huge learning curve for everybody, but I can only praise the people of the Isle of Wight and those leaders on the Isle of Wight that brought about that whole mobilisation of an island. It was amazing. And we've learned loads. And we've
Thank you, Jill.
Well.
Thank you, Jill. Now, we've got two people wanting to ask a question. One is from Michelle Legg, Isle of Wight Clinical Commissioning Group, and then the second one is from Andrew Garrett. So, Michelle, would you like to pose your question to Mike, I believe?
Yes, hi. Hello, everybody. It's Michelle here. Mike, I just wanted firstly to congratulate you on what an amazing document. I read it over the weekend, and it was really, it's really a fabulous document, I have to say. It reads really well, and it was really easy to read. We obviously talk about lots of new ways of working, and we do that in health, but I see that's mentioned quite a lot throughout your brochure or your document. So things like counselling, home visits, online activities, lots of new ways of working. And my question is, how is quality and safety being monitored? We always require that when we make quite quick transformation.
I don't think that's a question for me to answer, Michelle. I mean, that's down to individual organisations who are tweaking their services as they see fit, and they will have their own processes in place to consider that. And obviously, if they're a funded service, that would be something obviously that they would then pick up in their contractual discussions.
Yeah, Michelle, do you want to?
Okay, I mean, I just think it's extremely important that when we introduce when we transform services at speed and introduce new ways of working, it's important that we are assured that those are safe, and I'm sure that they are safe, and that the high quality that we're used to in the voluntary sector is maintained. And you know, I was just wondering how that is maintained, but you're saying, Mike, that that's maintained at individual organisations. That's, you know, but I do think it's important that we have some sort of idea about how that is being monitored.
Yeah, I think maybe that's a very good point, Michelle, and it might be something that could be taken up at a higher participant level. So I think we'll make a note of that issue and see how we can help to address it. So Michael wanted to make and he's actually before Andrew. So Michael, do you want to ask your question?
Yes, there's 1 or 2 points, but I come in on Michelle's point. I think that one of the things that you know, the mobilisation of the voluntary sector was incredibly quickly, and if we now reflect that none of us knew what a Zoom meeting was or a Microsoft Teams or whatever, and you know, the voluntary sector responded just as fast as the public sector did in being able to adapt to that and remote very quickly, and there was no gap between them responding to agencies like the Isle of Wight Council and getting help out there. There was just literally no gap. And on the quality, there was an acceptance by those bodies, you know, which included town and parish councils, a range of different charities, that you actually had to come up to a standard, and people did put in place about DBS checks, and within that had a complaint systems, a range of things. So I think that perhaps we need to present that better back, Michelle, but actually I was absolutely gobsmacked by the quality of standard of reporting, of support to volunteers that went into place. You also have to put into context that most organisations lost their volunteers from day one because of their age. So a whole new wave of volunteers came forward, a completely different age group that actually came forward. A lot of those were workers who were actually workers in organisations that were furloughed. But they came forward, and that was a very interesting thing, because in a sense the voluntary sector have been trying to attract a new level, a new age group of volunteers for a long time, and actually the situation's come, and we've still got that kind of commitment. So even if people going back to work, there are still signs that they are contributing within that. The other particular point was the community neighbourhoods changed. So people were very much working in their neighbourhood and supporting others in their neighbourhood, very much the sort of good neighbours kind of philosophy. And that has built up an infrastructure for the future. You know, literally every street had someone that was offering support to someone else, right? If not cases multiply. So I think it's very important that we build on that for the future. And my last point is town and parish councils absolutely did change in this time. They tended to not necessarily, give grants out, give support, but not necessarily be directive of their support, and that has changed. Practically every parish council across that actually got involved and has sort of now added a kind of social welfare kind of support system into their areas. Some more than most, like West Wight, the councils in West Wight, Ryde, Newport, Cowes, etc., Sandown. But the smaller councils, if you take somewhere like Knighton, they did incredible work and utilisation. So I think that Jill's point is very important, that this was a mobilisation where, Ryde was talking to Bembridge and Bembridge was talking to West Wight and whatever, and that hasn't really fully happened before.
Thank you,
I
Mike.
think we need to build on that.
Thank you. Some very good points. And what you said on the meeting chat has been echoed by Maggie Oldham, CEO of the NHS Trust, just saying that the Trust is indebted to all the support from the voluntary sector. So thank you very much for that, Maggie. Now, Jill, you wanted to respond to that, and then it's Andrew.
No, it's just to endorse actually what Michael has just said, that although we mobilised really quickly, we also were very aware of our responsibilities within that, hence, making sure that we had the right protocols in place and the right DBSs in place. And I was amazed at the calibre of people who came forward to volunteer. We had some amazing people who just sat down and wrote those and shared them. So this was an island-wide approach.
Yeah. So I think Michelle's point is very valid, and it sounds as though that we're well covered. But I think we just need to formalise the process to streamline. And now, where's he gone, Andrew? Are you still here?
Yeah, he's there. Yeah.
It's your go, Andrew. Put your microphone on.
Yeah, microphone's on. Thank you, Chair. I'm particularly taken with the points on page B19 of the report around the challenges in terms of other forms of voluntary support that could have been sought. And I was one of those who happily stood in a one and a half hour queue for somebody's prescription, wasn't put off, and came back. And of course, that settled. But had I known, for example, from a personal perspective, that people were interested in communications expertise, I could have volunteered that. So I'm wondering what can be done to, in a sense, broaden out the branding of the word volunteer to allow people to be proactive in coming forward, saying I've got this expertise to offer, but also from the other side of things, how to get organisations to say we're looking for this sort of expertise, so we can build a knowledge base that could be drawn out on as the report notes, could be providing that list of supportive contacts with these different areas of expertise.
Yeah, I think this is a very important point, and I think what we should do is seek how we take it forward. So we've made a note of that. So that's item 4. I think we'll move on from item 4 now.
Happy with it?
Is everybody happy with that? Yeah. So, Michael,
can I make a proposal of this?
Yeah, please do.
Of this, which is that we as a committee accept the report from the voluntary sector and wish to, I think in Maggie's words, thank them for all that their commitment, enthusiasm, courage and skill in supporting and working alongside other agencies to make sure the most vulnerable in the island did get support.
Thank you, Michael. That's a really good idea, and the voluntary sector need noting in that way. So thank you for doing that. Can we have a seconder for that, George? And then we'll vote on it. So put your hand or thumb up.
Do you want to go around?
So go around the virtual room. And then if that's
All right. Okay. Yeah. Megan's going to go around the virtual room. Okay.
Councillor Cameron.
In favour?
4. Councillor Garrett.
4.
Councillor Howe.
4.
That's 4. Councillor Lilly.
4.
And Councillor Nicholson.
4. Oh, that's good. That's the professional way to do it. You can tell I'm just an amateur Zoom player. So we'll move on to item 5 now, which is an update on key issues in health and social care. So the first item under this is public health update. Now have we got Simon with us? Yes, Simon, did you want to lead on this? Welcome, Simon. Nice to see you.
Good evening. Yes, very happy to lead. So a very short paper just giving an update to the Committee on a few issues in public health. Firstly, starting with the public health strategy that was signed off by Cabinet in June 2020, and I thought it was just worth bringing that here because I don't think it came here due to COVID on its journey. Just to say that we are developing those action plans. And to remind the community, this is the Council's public health strategy, and then we are working with our colleagues and partners around the system to make sure that we have a fully system-wide approach to prevention and public health, working with the Isle of Wight Trust, the CCG and the voluntary sector. So that's going ahead very well. Really pleased that the island now has a public health strategy. If I just move through the items quickly, I can take questions at the end if that's all right, Chair. So with regard to service delivery, just worth updating that our programmes are being stepped back up again with a more focus on the face-to-face support, as you would expect, particularly for those more vulnerable clients. So some of the things we implemented over the kind of lockdown period, such as treatment by post or less frequent prescriptions, those where it worked well, we will establish, and those where we need to review, we have done that. So that's really, really positive. And furthermore, we're developing our models for stop smoking services and weight management services going forward. So some key work there that we want to do. I guess it's well known the key area of work that we've been leading is the COVID response. And whilst other areas are kind of recovering, we are still in full response mode from a public health perspective. So I'll give a little update about that if that's okay. So just to start off, we're in a very good position with regard to COVID-19 and the number and rates of cases. Just to update the data, because I've submitted it as of this evening, there were still 2 cases in the last 7 days, obviously different last 7 days, and there was that brings on total number of cases to 444 cases. That is a rate of 6.4 per 100,000 for the last 7 days. That rate compares with the England average of 33.2 and 14.8 for South East for the last 7 days. So you can see we're in a really good position, a really positive position with regard to coronavirus. We do know that hasn't impacted the same on different populations. So we know there's been vulnerable communities impacted, those BME populations and those who are obese. So we need to really think about how we manage that and also support those communities now so that they can prepare for any increase in cases. So actually we're ready for that, and we're doing work with the NHS and with partners to do that. So we've now moved to a phase where we're tracking and tracing cases through both the NHS Track and Trace programme, Public Health England and our local approaches, and that's about increasing testing in the communities. And I do know there's been a challenge with testing, particularly in the last few weeks. That is due to a national issue in the labs. So the lab capacity hasn't kept up with the demand for tests, which is a huge problem. So we are working with our Department of Health and Social Care colleagues as much as we can to increase that testing lab capacity. And we are also looking at whether how and when we step up a local tracing support programme alongside national test and trace. So this we're developing that with Public Health England to see what we should do there. So finally, just worth saying, the governance for this is we've got a health protection board that I chair weekly with colleagues from the Trust, from the CCG, and key officers from the council to look at the data, outbreaks and situations, and oversee any significant events such as going on in the community. And then we also log any care homes because I have a role to ensure care homes are safe, and if we close them to visitors, I do have that authority. And then we also work to think about communications, the powers that we need to implement to do anything, and agreeing any risk and mitigations, and we do that on a weekly basis, and that's been very successful. So that really kind of gives a very brief summary of the work we're doing, dealing with cases and outbreaks and situations on a daily basis, 7 days a week. So we're doing that to protect people and prevent spread and manage outbreaks. The final paragraph 17 and 18 just highlights, as the chair requested, a little update on Public Health England. Not much to say yet, but we are working with them to ensure that there is a safe national programme and approach for public health, not just around health protection, but for the rest of public health remit nationally. Through the Association of Direct Public Health, we are giving views and input to that development. Chair, I'll stop there and happy to take any questions.
Thank you, Simon. So we've got questions in this order from Joanna, from Michelle, and then from Michael, and now John Howe. Whilst you were talking, Simon, Maggie did send a message just to say thank you so much for the support you've given the NHS Trust and during this critical time. And I think it has to be noted, Simon, that you seem to have an inexhaustible amount of energy to devote to this, and I think you've really stepped up to fill your position very, very fully. And you know, that's just from a humble observer, but you know, well done.
Thank you very much for
those lovely comments. To Joanna, please.
Hi, thanks, John. So I just wanted to ask a couple of questions. So just around the testing. So a lot of people have contacted us and can't access a test at all, or they're sent, you know, to somewhere very far away on the mainland. People are also concerned that people are being advised to come here from the mainland. So is that being addressed? Is the system that works out kind of distances gonna look at, you know, logistics when people have to travel and risks associated with that, such as having to travel by ferry. And the other thing was, I don't know whether you can answer this, but I wondered whether you had any information about the app. So the COVID app is due to be extended nationally within the next couple of weeks. Healthwatch England has worked really closely with NHS in the development of the app, and through them we clearly stated that they needed to communicate a lot better with the public, particularly the Isle of Wight public, around the app, advising that they should give regular updates. People want to know, you know, the Isle of Wight population generally happy to help, but they want to know how it's helping people, whether the app is successful, how many people have downloaded the app, what it's done so far to support the kind of track and trace system. So we wrote to the Secretary for State as well with our concerns about communication, and I just wondered whether you could give any more information on that.
Thank you, Joanna. A couple of very good points. Simon.
Yes, thank you, Joanna. So on the first one, so as you've probably heard, nationally, people were being sent from, you know, Cornwall to Inverness for a test, which is obviously completely inappropriate. So they put an arbitrary 75 miles onto the website, so you can't travel more than 75 miles for a test. However, that doesn't take any other considerations in, and I'm being really clear that actually probably travelling 75 miles for a test is inappropriate in itself, because you put me and my family in a car, actually there's no way I'll be able to travel 75 miles and get there, have a test and get back without stopping for a wee somewhere with a small child. So actually that travel is not appropriate for anything. For the Isle of Wight, it's even more acutely important, because actually you have to be in a, if you're in a car, you can stay in your car. So we have raised that, and we keep pushing that up the line on a daily basis to try and resolve that, and it's not resolved. But I think it's not acceptable for you to have to travel far for a test, and that is because the lab capacity isn't there. So they shut the local testing facilities down, particularly because we're in an area of low prevalence, which is really, really good for us, but it doesn't help that situation. So yes, I agree with you. We're doing all we can, which is a national problem we're trying to solve. With regards to the app, I'm not that close actually. I think it is an addition to our test and trace. And can I just really emphasise, our contact tracing is going really very well on the Isle of Wight and locally in the southeast. We trace, I think it's well over, I can't remember the figure, but it's well over 80%, which is really, really good. And that means we are contacting the vast majority of people, which enables us to do that proper contact tracing.
Thank you for clarifying that, Simon. That's really important. Yeah. Michelle, what was your question?
It's sort of on the same line, really, a bit of a plea. All weekend, there hasn't been any internet access to book any tests at the testing site. There hasn't been any availability to get any postal delivery. And obviously, we're not advising people to drop in. That was the case all day today. I've had several inquiries. I've had police queuing outside because they want to know what to advise people, because people are ringing. So we haven't, and it said particularly on the internet site today, please do not ring the phone lines. So today and yesterday, and I'm not clear on Saturday, we've been unable to book internet, phone lines, no postal. Now that has, and I totally appreciate what you're saying. And I had I was explained to me today about it was the lab issue, but this really has to be escalated nationally extremely quickly. We haven't even gone into winter yet properly. We haven't even got a surge, and the system is really faltering. Really the plea is to really, this needs to be escalated as soon as possible. You know, on a different level, I can access Amazon. I can get a computer stand. Yesterday afternoon I looked, it's delivered today, I appreciate the rate limiting step is the lab, but they have to sort this out.
Yeah, absolutely agree with you. So it was escalated. I'm trying to think which day it was. 2 weeks ago now, all the chief executives from the South East local authorities wrote to Dido Harding and to the Secretary of State. And I think that's why you started to see the pressure coming out saying we apologise, is some national apologies. So absolutely, we're pushing it. There is some increase in lab capacity with Loughborough coming. I think it's Loughborough coming online. It's our biggest risk because we can't test people. We don't know who's got it, and then we can't contact trace them, and so on and so forth. So you're absolutely right, Michelle. We are pushing. Please do push through all the routes that you can push, because actually we do need to resolve this, and it's difficult because we've been given local control over it, yet I haven't, my hands are tied behind my back, so I can't do anything. We're working very closely with your teams and the Trust to see how we can work together on this issue, to see if we can do some kind of local solutions in the interim, particularly for outbreaks where we're concerned. So we are we're doing that as well. So I agree. I'm very much
so Michelle, Alison Smith has just posted that you've seen that, and and we got John Metcalf. John, did you want to say something on this item?
Yeah, yes, thank you, Chairman. I think Simon's probably made the point I was going to make about all 23 upper tier local authority chief executives in the South writing to the Secretary of State saying effectively, you know, you want us to work on the testing programme, but we need to have access to the tests. And as Simon has highlighted, I think there's almost a daily letter that's going into civil servants at the NHS to make the point about, you know, having this local control, but also the specific unique circumstances about the island. I think the one point that is worth making, though, is that, you know, booking slots are now made available the evening before for morning appointments and the morning before for afternoon appointments. So just because people try and can't get through the first time, we'd encourage everybody to just keep coming back to the 119 or to the website, because the slots are being sort of released on almost a kind of half daily basis. So the first time you might not get a slot, but the second time you might get a slot. So we'd encourage everybody to return on a regular basis to make sure that they do get a local slot. But in the meantime, we'll keep the lobbying up, and I understand the MPs also raised it directly with government as well. So a multi-pronged approach at the moment.
Can I say book a test if you've got symptoms? We want the right people to book tests. So don't book a test unless you've got symptoms. That's the, you know, we can't just have people turning up. Sorry, John, to add to that.
So maybe we could have a press release just to confirm that. I don't know. So Michael, it's your turn now.
Before I go on to my questions, I just want to come in to this point. We obviously, as a health scrutiny committee, do have some powers, and we do go up to the select committee in government. So I'll come back to this, but when we end this item, I think it's important that we put a proposal from this committee that we actually support, you know, from what Michelle and others have said, this very crucial thing on testing, which is very important. So I'll come back, if you can make a note, or Paul can make a note, to come back for a proposal in that regard, because I think we should put our lobbying powers in place in regard to this. And to personally do it, I spoke on Zoom today to two, you know, key workers who have got symptoms and are desperate to get a test, and were actually very distressed that they couldn't go into their jobs and everything today because of it, and actually caused them a lot of distress. So we do really need to all come together and lobby as much as possible. I'll go on to my questions, Simon. I mean, thank you and your team for all the work you're doing. I'm very puzzled by these COVID-19 marshals that have been announced by the government, particularly around social distancing and the groups of sick. Any more information about those COVID marshals? Who will they be? Who will be responsible for them? What's the governance, etc., regarding them?
Very good questions, Councillor Lilly, and I think we're waiting for information and also how they'll be funded. So we're just waiting for that. And what we do on the island have COVID ambassadors, kind of beach ambassador type role, and they're doing very well. But we haven't had the full detail of what they are and what they're going to do yet. But we are talking to police colleagues, because they've got powers and how we work that together. But I'm afraid I have no more information at this point in time. I'm waiting for government information on that.
Thank you.
Before I go on to my other question, I have to sort of say that, I mean, you did have beach ambassadors over the summer. I think there could have been better communication with parish and town councils and things at local level. There were some incidences where there was confusion with the ambassadors, particularly in Wight, from my experience. So I do think that if you're going to have COVID marshals and going things, that there does need to be that communication with the various communities on the ground to avoid that. I think the word of communication was raised by Joanna, and I think we need to look at improvement on that. My last question was on your data. We obviously were very concerned at the beginning of the summer. If you'd had a vote on half the community, would have voted to not allow any visitors on the island, and the other 50% obviously desperately wanting it to get our economy going. We've obviously had considerable numbers of visitors, and it looks as if from your data that we are still low risk, even though we had people from all over the country coming here. You couldn't get a camping site, most beds were full, so people were coming. Obviously the Fast Cat got going in August, and people were coming over, and we had a huge amount of day trippers and things. So can you sort of allay our fears that actually we have successfully brought visitors over and still kept low risk? Have we got evidence on this case?
So I think there's a number of things to pick up there. You're right, we have a low number of cases. I think we have to remember we're still in a pandemic, so the risk is still there. Also, the risk is greatly reduced if people do social distancing, wear face coverings and do good hand hygiene. Actually, we need to be really good at that as a community, and that's something we really need to keep promoting. And actually, and if businesses are able to do that with their visitors, as with the people who live here, that would be really, really positive. And maintaining that will enable us to lower the risk as much as possible. But we do know that there are cases in the community, and as I said, we're up to 444. So it's just being really mindful of where we are and to remind the public that this is still a risk that they need to be aware of, and to keep those measures in place and to do them personally. And it is really hard. And I want to thank the Isle of Wight residents for doing these strong public health measures. As you said, I never, as Director of Public Health, thought I'd be doing this strong public health measures. So that's where we need to be mindful of and remember that there is still a risk of coronavirus spreading.
Right, thank you.
Sorry, can I ask a supplementary to that? Was the specific question is on the visitors, have we got data that our relationship with visitors, which is crucial to our economy and has been crucial of this part season, some businesses have needed a couple of months of visitors to come forward. Have we got evidence that we are a safe place to visit for our residents and for our visitors?
I don't think we can say we're a safe place because we're in the middle of a pandemic. What we are seeing is, as I said earlier, we've got a low number of cases, which is really, really positive. We're managing those measures that we have to put in place to manage that spread. Any kind of increase of this, if you don't want to catch coronavirus, stay in your house. Actually, but that's not good for the economy. That's not good for us. So let's go out and about. And so we're going to see, as people go out and about, more spread of infection. But if we can keep those measures of 2 meters apart, good hand hygiene and a face covering, and now the rule of 6, that will really help us to keep that risk down.
John Metcalf wants to comment on this now.
Yes, thank you, Chairman. If I may, just a brief comment, because I think one of the things that did happen before the summer was a huge effort from the hospitality industry to make their buildings, their premises COVID secure, with a huge amount of help from the environmental health team, who spent a lot of time in webinars and seminars, giving them help and advice. So I think the buildings that open up, and the premises and businesses that open up in as safe a way as possible. I think Simon is absolutely right, though. Safety is ultimately down to the individual and people following all the appropriate measures about hand, face, and space, which I think is the latest buzzwords. But everybody on the island, in terms of businesses, work very hard to put those businesses in a COVID secure way. Our environmental health teams continue to work with all businesses about how they can operate in a COVID secure way. But as I say, it's down to the individuals. And I think perhaps a question back to Simon, but I still don't think we really know or will know the outcomes of the summer for another couple of weeks, given the incubation periods that go with the virus and how things pass. So, yeah, I think it's probably too early to say, but I think there was a huge response from businesses to work with us and open in as safe as way as possible.
Yeah. So when it is a good news message, John, we can announce it as a good news message. Now, last question on this section from John Howe, Councillor Howe. John, are you there?
I'm here. Thank you, Chairman. And my one question is, I'd like to know what's in place for care homes if this epidemic does get worse over the coming months, but whether we're waiting for something to happen and then all panic, or is there something in place to actually have they set up a program to prepare themselves, and so we're not in the same mess as we were with providing the right equipment and everything else to these care homes to be able to deal with it.
So I don't know if Laura's on the line or Carol, but I don't think so. If I start off and others can add in. But we've got a really good program with our care homes. My team works very closely with Carol Tozer's team, Director of Adult Services, to ensure that actually the care homes, all the way through, yes, you're right, this, came through quite fast and we needed to kind of be on the front foot. Things like personal protective equipment, managing outbreaks, any situation. So as soon as we know situations, we manage those. We're doing a lot of preventative work to ensure that spread doesn't take place in the homes. There is a weekly testing program, but again, you will have heard that's slightly slowed down by the lab capacity issue. There's a number of things in place that means that we're in a really good place with our care homes to support them should there be an outbreak, to help them prevent it, and also to kind of manage that on an island-wide basis. And I know that others may come in and be able to help.
Simon. Yeah.
So we're now leading into the second item, but just before we do that, I know there's Alison wants to make a comment, and Joanna wants to make a comment, but we'll take those into the second section, which is adult social care. Before we do that, Michael made a proposal that the Scrutiny Committee makes a representation about the situation regarding testing. Now, before we go ahead with that, I think it's important to ask maybe Simon, is that helpful, Simon? Because there's no point in doing it if it's not helpful. If it is helpful, then there's every point in doing it.
So from my perspective, nationally, they are fully aware of the issue that we're dealing with. They're fully aware of the challenges and they are doing what they can. We've put a lot of pressure on them from South East, as John said, the 23 upper tier local authorities in the South East have written. So that we've done an awful lot of work to do that. Another letter, I'm not sure if that will help, but obviously that's within your right to do that if that's what you'd like to do.
Let's not miss the opportunity. Let's then, if Michael's in agreement, make a proposal that the committee supports the campaign for better testing, and we're prepared to send a letter if and when needed, and then we park it until it's needed. So is that your proposal, Michael?
Yeah, that's my proposal.
Right. Can we have a seconder, George?
Yeah, I totally agree with that, Chairman.
Yeah, good. So Megan, do you want to do the rounds then?
Councillor Cameron.
George, do you agree? Yeah, of course he does.
Dudley, yes.
Yeah, yeah.
Councillor Garrett.
Oh.
Councillor Powell.
Agreed.
Michael?
Oh, sorry. Yes.
Four.
Four.
Yeah, and 4. So that's unanimous. So we voted to support. So we'll park that when it's needed. So now we've got a question from a comment from Alison and a question from Joanna, and then Claire wants to make. So we're firmly going into item B. So let's take it in turn. So Alison.
Thank you, Chairman. I just wanted to add to Simon's comments about the support that's gone into care homes. There has been an integrated response to support care homes, both from our primary care colleagues who have aligned themselves 1 GP per care home, who have regular contact on a weekly basis to help not just with COVID issues, but some of the ongoing health issues that some of our residents will be facing. But in addition to that, I'm very well aware of the support that's gone in terms of training and access to infection prevention control, to PPE, and to also medicines as needed, alongside the work that's happened through the discharge guidance of now testing every patient before they leave the hospital, and or if they require respite care and are using a care home to try and minimise the risk of COVID. And each of the care homes I'm aware of, because we're part of a joint group that review this, are taking actions to minimise the risk on a regular basis, either with their workforce, as testing as Simon has said, but also in terms of not sharing their staff in the same way that they were before. And we have seen some incredible stories of, I don't know if you recall earlier in the pandemic, of people staying overnight in tents in gardens of care homes to help support their care home. There's been a huge response to try and keep them safe. And we're working together with all the community services, with social care, the Trust community services, primary care, pharmacists, obviously the voluntary sector, all of the quality bodies that you would expect, from infection prevention control to safeguarding and just general help and advice. I'd also like to share that during the first stages, when some of the staff who were shielding or affected with COVID really affected the workforce that was available to care homes, the Trust actually offered staff up and who went in and supported those care homes actively with nurses, people to help support those residents in the care home. So I think there's been a huge response to keep our care homes safe, and obviously we can't relax, we cannot become complacent, and that work continues. And we will continue to respond in the same way as a joint system to help ensure that those people who work and live in care homes is protected to the best of our ability.
So thank you for that reassurance, Alison. It was one of the questions that we posed in writing, and it was responded to very fully, and Kirk has just endorsed that. Now, before Joanne, before we allow you your question, I'm going to ask Claire if she wants to make her comment, just in case she answers it before you ask it. Claire, where are you?
I'm here. I am here, sat in my office at home. I didn't think I'd ever get so used to my own utility room, but you know, hey ho, the world we live in now. In answer to John's question, really, I think we need to be really careful that we don't label what happened nationally to what happened on the Isle of Wight. You know, I think, you know, those that work within the system have found that they stepped up to proper collaborative, integrated working, you know, and my thanks go out to the CCG, everyone who works within adult social care. Our performance, I think, was absolutely amazing. And I can say as a person of experience of that, because my daughter actually works in a care home, you know, and every week she is tested, you know, she works with people with dementia. She knows how difficult that is to actually test people in that situation. I read all the data that comes out every week. I read all the data that comes in the round robin phone calls that go to all the care homes. And I think our performance on the island within adult social care and the whole system has been second to none.
Thank you, Claire. So, Joanna, your question.
Thanks, John. No, it's not.
Right, good.
So I kind of just wanted to reiterate some of what Alison said about the sacrifice that care home managers and staff have made. It's absolutely incredible. They are still under a huge amount of pressure, even now, all these months later, and they face a pretty dark winter trying to protect their residents. I've spoken to some care home managers and staff that have not accessed public transport. They've not seen their own family. They've foregone holidays purely to protect their residents, and they're prepared to keep doing that. And to do that for so long is absolutely incredible. But I just wondered, we're also aware that every care home has taken a different approach. The government guidance has been prolific and extensive, has changed frequently, and we know that some care homes kind of locked down pretty early on. Other care homes didn't. And I just wondered whether there's any analysis done of the different approaches that care homes have taken and whether that's contributed to their homes remaining COVID-free. I mean, I appreciate that some of it's down to luck, but I just wondered what learning we could get from the different approaches taken by the different care homes.
Right, Mark, who's responding to that?
Okay, I'll come in before Mark, if that's all right. I'll play the cabinet member's prerogative. So I've seen every single week all the data, as I said, and it's quite clear, you know, when you look at the data, where the cases were and when they weren't. I think we have to remember we are not at the end of a pandemic. We are in the middle of this. And I think, yes, there will be lessons to be learned, but there's no point in starting analysing data when you're in the middle of something. You really need to do that at the end. I think the support that adult social care is giving to those staff from that data that comes out is really important. So if they see that a care home is struggling, they are sending the support in and the training, as Alison said, to actually help them. But analysing that data now and then generally circulating that is not going to be helpful. I think what's important is the staff within adult social care and CCG are aware of what's going on and are putting in exactly the right support at the right time to help registered managers who might be struggling, even to have a sort of a buddy system with other care homes who are doing really well. So that support is there and it is knowledge, but I don't think it needs to be, that data to go out wider. I know Andrew Garrett would like the data to come out now, but I think it just needs to be wait until we're towards the end of this to share that. The most important thing is we are doing things the right way and supporting everybody within the whole independent care home system. Sorry, Mark, I'll hand you to you.
So I've got John and Andrew with their hands up, but we're in danger of asking questions before we've heard the verbal update. So I think we'll go ahead now with the verbal updates, which I guess is you, Mark, on items 1 and 2, please. If you could
thank you, Chair. Thank you, Chair.
What hasn't already been covered?
There is a presentation, so I'm hoping someone will be able to put the presentation up.
Did you?
It was submitted.
Yes, I've got it ready to show when you want to show it. Well, I'm going to try anyway.
Put that presentation up, because that will provide the necessary information for
just bear with me
members,
1 second.
also those in attendance this afternoon.
Right. You should be able to see that on your screens now. Can you just tell me when you want me to move along? I
will do, of course. Okay, thank you. So if I begin, John, with I suppose the context for adult social care in terms of, I suppose, the financial picture. So prior to the onset of COVID-19, the following calculations were made in terms of level of funding required for adult social care. So it places it on a much more sustainable footing. There's much discussion already had as about sustainability, pulling resources together, working collaboratively, which is key. So the House of Lords advocated £8 billion per annum to restore care quality and access levels to 2009-10 levels, addressed increased pressures and also to support unpaid carers and the level of unmet need that we face across our communities. The Health Foundation estimated that to meet the expected growth in demand from an ageing population, and we're very familiar with that in terms of the island, in terms of the ageing population, and the increased pay would cost around about 6 billion by 2023-24. That context, moving into a pandemic, adult social care was already under-resourced to deal with the COVID-19 pandemic by failure of successive governments of all political colours to recognise and understand how important it is to people and carers who need it, and 1.4 million people who work in it in terms of adult social care, by the failure to put social care on a sustainable and enduring footing, which is fundamental, looking ahead, looking at the horizon in terms of the challenges we face and in the context of COVID-19, of which we're in the middle of. So post-COVID-19, in the context of a highly probable long, deep recession, I've already mentioned about research, about looking at what lessons to be learned, but we are still in the middle of something that looks like it's going to continue for some time. But adult social care, in terms of the Isle of Wight, is a major contributor to the economy and needs to be factored into regeneration plans going forward. Have the next slide, please. So the government published, in response to COVID and adult social care, this whistle-stop tour that, to give you a flavour, the government published the D2A requirements, the discharge to assess requirements on the 19th of March, which included the requirement to discharge all people from hospital within 3 hours of being declared medically fit for discharge. And as part of those requirements, government allocated in total 1.3 billion to CCGs who became financially responsible for funding up to 12 weeks, is which we've operated on the island, people needing care and support not already funded by adult social care to leave hospital and avoid hospital admission. Government has recently updated this guidance, and the CCGs will continue to be responsible for funding care for up to 6 weeks as we go through this phase of the pandemic. On April the 15th, government published the Adult Social Care Action Plan, and that included the need for all people being discharged from hospital to care homes to be tested for COVID. And councils had to develop and submit a care home support plan. We've mentioned about the care homes and the need to both collaborate but also engage with them, which we have done with all our partners on the island in terms of the response that we have been providing, and we've done today and we'll do tomorrow and will continue to do. But the government placed that responsibility and framed it within that support plan. An adult social care task force was established on the 9th of June, and its final report will be published in September, but there currently is no firm date for that as of yet. We've been notified that adult social care will need to develop a winter plan as we go into, and we've already mentioned this today, into winter planning and also managing with this pandemic, to be submitted to DHSC by mid-October. We expect to receive guidance imminently, and we understand the government is also considering an additional round of infection control fund, which I'll touch on shortly, but this is to be formalised. And finally, we've been notified that we'll have to complete a self-assessment about risk facing local care providers, picking up on the point already raised around needing to understand the real challenges for our provider services across the island, and then the mitigating actions that we'll take against those risks collaboratively. And have the next slide, please. So the focus on care providers, the response of adult social care, care providers, social workers, commissioners, has been magnificent, as has been the NHS and the people who work in it. And I've noted the commentary in terms of from both Alison, but also Maggie Oldham and colleagues from health, but also was really warmed by the conversation we had in terms of the voluntary sector and their input, which again was magnificent in the way of the speed at which we pulled things together to deliver for people on this island, particularly family carers. So particularly, as already mentioned, keeping shielding and keeping people safe. It was just natural that people pulled together on the island in different communities. And I know the different cells that were set up, particularly with the voluntary sector, was most welcomed, and many volunteers that we also saw within the service, but also within some of our homes, council-run homes like Adelaide and Gouldings, where we had volunteers supporting the staff that are in those homes. And certainly on my visits there, some of the work that you could see and the care, attention to detail that staff were providing, again, was at the top level. A key lesson is that a pandemic response that focused on emptying hospital beds, which we fully understand, without considering the impact on social care, did have huge consequences. Not starting testing of people entering care homes from hospital until the 15th of April, which we are fully aware of. Social care was initially an afterthought. Next slide, please. So, CQ registered social care provision on the Isle of Wight, just to give you a flavour in terms of the numbers. Home care providers enabling 1,220 people to live well in the community on this island, and they employ 1,082 care staff. Residential care providers enabling 1,190 people to live well in residential care, employing 1,496 care staff and employing 403 ancillary staff. Nursing homes enabling 451 people to live well in nursing care, 411 care staff, 71 nurses and 174 ancillary staff. In addition to that is the work that's been developed within the commissioning side of the service managed by Laura, has been the creation of what we call personal assistants and a PA hub of 288 staff that are going out and supporting people on their terms, working with them to enable them to live independently within the community on the island. Next slide, please. So we've mentioned this, we've touched on this in terms of supporting the care providers. Personal protective equipment, care providers have experienced very significant pressure, especially in securing masks and face covering. Gloves and aprons are usual PPE uniform in adult social care. Providers have also faced hyperinflation costs for PPE. The council's made available approximately 200,000 items of PPE to providers whose own stocks have become dangerously low, and this has been free to our care providers. Financial support. The council has the £9 million received from government to help people's cost of COVID-19 in adult social care, and this enables us to temporarily uplift care fees paid to providers by 10% from the 16th of March for 12 weeks at a total cost of around £898,485. In addition, we'd received 2.58 million in the form of infection control fund, and we'll expand on that in a moment. In order to further support care providers, government provided strict criteria as how council should allocate this money, and we have had to submit verification of our allocation to MHCLG and DHC, Ministry of Housing, Communities and Local Government, etc. Next slide, please. So, in terms of the Infection Control Fund, I think it's clearly lodged down. I won't go right through the detail, but essentially 75% of the fund had to be allocated straight to care homes on a per bed basis. So we had 1,919 paid to providers in instalments, the 1st of June 2020 and again on the 5th of August 2020. And 25% of the fund used to support other COVID-19 infection control measures as specified there in terms of home care providers, supported living services, community service provision, day services, and contingency where further care home support is actually required, and the breakdown in terms of the description there. So we were allocating the resources to strengthen support our providers in terms of infection control And I know Simon was on earlier on, but would absolutely understand the importance of ensuring that those providing care as well as receiving it are safe and protected from infection. Next slide, please. The Isle of Wight Council Emergency PPE Service, since the 9th of September, the number of individual providers supported, we've mentioned PA and home care, 63, residential nursing homes, 56. And it totals out their breakdown of the sort of PPE equipment that we were supplying to those providers, and will know and be familiar with safety glasses, safety visors, sanitisers and aprons, etc. But the total number of items provided in both settings was 354,535, and the total number of individual requests from both settings was around about 302. But we have a very connected and close relationship with our providers and partners, and work very collaboratively in terms of how we both delivered and monitored the use of that equipment in terms of the best interests of the people on this island who are vulnerable and needing our assistance. Next slide, please. So the care homes with PPE status, amber, no one got to the status of red through the duration, and during this period only 10% of care homes reported as being amber. Generally, PPE equipment was balanced in terms of the key items: aprons, eyewear, gloves, masks and sanitisers, as demonstrated there. Some variability, but nobody getting to a zero stock according to our monitoring of that delivery. Next slide, please. So care home vacancies, this is interesting in terms of the numbers of vacancy levels, both in residential homes and nursing homes. We saw a drop in terms of nursing homes and an increase in terms of our residential sector. And again, when we go forward, and we've already mentioned this about lessons learned, research, what does this tell us in terms of the impact for those living in residential care and sadly passing away within residential and nursing care? It starts to paint that picture. Next slide, please. People supporting care homes and the community diagnosed with COVID-19. Again, a lot of this in single figures or zeros. In terms of cared for in the community, very few. In care homes, initially numbers high, but again coming right down there in July, end of July, and then throughout August, and a slight blip towards the end of August, and again as we enter back into September, of which we are monitoring. And I think it was mentioned in discussions that we've had, where when we're alerted, the response is comprehensive. It isn't just, oh, there's a problem there, the home needs assistance. We go in, we work with health colleagues, we work with public health, and we produce and support those individuals to ensure a good infection control and ensuring the person is safe and well and supported. Next slide, please. Support staff unable to work. And we begin here in early July with the numbers significantly, well, not significantly, but they are clearly raised with some degree of variability in all sectors, both residential, nursing and domiciliary care. But clearly we are coming down, particularly in both the domiciliary care and nursing care, less so in residential, but the numbers of staff unable to work as we've sat here, as we've positioned here the 8th of September, was clearly in a lower position than we began in July. So some degree of, well, a high degree, well, there's a certain degree of positivity there in terms of, we know clearly we need staff in homes. We need to support the teams who've worked tirelessly in independent sector provision and across our homes in terms of staff numbers and capacity, because the pressure that places on the system. Next slide, please. So, final slide, the feedback from the providers. A number of things here, but I will just go through them because I think they are important in terms of ward, house residents and staff. I'd like to pass on our sincere thanks for the continued support that the Isle of Wight local authority have given us in the past few weeks. The current situation has been unprecedented, and we feel that you and your team have risen to the challenge through outside the box and achieved the support that we need. So people really thinking innovatively, really thinking solution focused, really thinking people first, person centred. Thank you very much. Stay safe and well. We really appreciate the work you're doing, Highfield Nursing Home. Thank you so much. This is a massive help with when we'll relieve some of the pressure we're all feeling, the Briars. Extremely grateful that St Helena will be supplied disposable masks. Thank you for your help and support to keep us safe. The Chief Executive's asked me to thank you for providing valuable and efficient service. You're all doing a very important work in supporting us in the front line. Thank you, Ride House Group. And finally, thank you for the thoughtful help and support, Downside House. So what we have here, as my final slide, is a bringing together of, I suppose, for adult social care, how it's worked in partnership, how it's pooled resources allocated to it from government resources, worked in partnership within its strategic groups, its cells, across voluntary sector, with health colleagues, with very fresh and new ways of working and transforming, delivering that, and continuing to have an appetite for that as we go forward into the unknown, because this is unprecedented times for all of us, and particularly for those out there on the island. We need to be strong and we need to be solid. And I believe that with our providers and how we've worked providers and continue to work providers, that's exactly what we will do. Thank you, John. I'm happy to take questions.
Mark, thank you very much for a very comprehensive and, can I say, clear, easy to understand presentation. Now we've got questions outstanding from John Howe, Councillor Howe, and Councillor Garrett. So if your questions haven't already been answered, John, where are you?
I'm here, Chairman. I'm here.
Okay.
Hi, John.
I just want to say to Mark, thank you very much for your presentation.
Thank you.
He has solved a lot of my questions, because I was very concerned that not that the people don't work hard in the care home sector or the nursing home sector as well, is that what we don't want is chasing around the country or even chasing around the world when we get short of gowns or face masks or anything else. I would think it may be a good idea. I don't know how Mark feels about that, but whether we, over the period of time, had a quick visit to each of the nursing and care homes just to make sure they are retaining enough stock to be able to go forward without having to have a panic.
John, if I may, Chair, I mean, we logistically we manage the stock of PP equipment across the island. We monitor its delivery, and where there are shortages and where we need to provide, we are fully aware where those issues are with our providers, and we will ensure that homes aren't left in a position where they have no relevant stock in order that they continue to provide care on a day-to-day basis. And certainly Laura's team, in terms of the commissioning and partnership side and the equipment and delivery side, in partnership with health, in partnership with other colleagues, ensures that we no one falls short. And I have to say, it's been an amazing job, the way in which we've orchestrated that, how we've just joined it up, responded immediately where a home's saying, I have a problem, and keeping the lines of communication open with providers. As Laura, if you know Laura, that's exactly what she likes to do, ensuring good, clear, clean communication and responding effectively in partnership. So I feel I can give you that assurance that we will do our utmost, John, to ensure that homes get what they need.
Thank you, Mark.
Thank you very much. I appreciate it.
Andrew.
Thank you, Chair. I wonder if we can return to this question that Joanna Smith put to the Cabinet member and the Cabinet member's response. If I've understood that correctly, there is data available that could be very informative to the care home sector on the Isle of Wight, but the Cabinet I may have misunderstood the Cabinet member's response to this, but that she felt that it was wrong to analyse that data at this moment in time.
No.
I think we need to explore that more as to
That's not what I meant. Sorry, Andrew. I did think I probably didn't come across properly to you. So the data is there and we are using the data. What I didn't want to do is that data is being used all the time to support the care homes. That's where it's important, is to use that data for adult social care to put the support in the right places. What I didn't want to do is publish data on individual care homes in the middle of a pandemic that might put pressure on those care homes. That's for within this local authority to support those care homes with the data. You know what things are like when they're put out into the media, and it's like, well, look, that care home didn't manage it as well as another care home. And I think that's actually not useful at all. So the data is being used. It's being used on a daily basis, but in the appropriate sense. What I don't want to do is do a big report now, and it isn't our data to publish out at this precise, out to the, as long as it's being used appropriately, it is being used. I dare I say it, sometimes things can become a witch hunt if people think, well, that's not being used appropriately. So we're using it to make sure care homes are supported. And sorry if I didn't make myself clear.
Thank you for that clarification, Claire. Now, Joanna wants to comment on what you've said or what Andrew said. Joanna?
Yeah, it's just a quick point. I don't think anyone suggested for a minute that we would or want any confidential information out in the public domain. And certainly, I know a good number of care homes that have had COVID positive residents, and they've managed that very well. But I think there's a lot of learning that could be got from that as well. So the care homes that have had 1 or 2 cases and they've maintained it at 1 or 2 cases, protected all the other residents and staff, there's a huge amount of learning about how they managed to do that. So I'm not suggesting for a minute that we disclose which homes these are, but I think there is some learning about how homes have managed individual cases and how they've managed it overall. Not for a blame, which
absolutely, Jen. We have also kept our forums going, so I know that all the forums are there, so that information is shared and used with it. As I said, my daughter works within a care home. I know John Metcalf wants to comment as well, but I know the lessons that are learned, they are shared, and the island spirit, even though these are independent care homes, is absolutely stunning, really, how they've worked together.
John. Not Councillor Metcalf, Managing Director Metcalf.
I was just going to make exactly the same point that Councillor Mosdale's raised. I think the work that has been done by adult social care and running regular webinars with care home providers, where there has been a sharing of learning and a sharing of information, I think has been really positive. And I think, I know from personal experience, having seen it, that the contact that the Adult Social Care Commissioning team have had on a daily basis with care homes, giving advice and guidance, that where they've taken and distilled the learning from certain areas and put it into other areas, has been really powerful, sat alongside the help that's gone in from the CCG and the Trust in terms of specific one-off pieces of help. So I think all that learning is being shared and has been passed across, and people are talking on a very regular basis to be able to do that. So I think Joanna's point's really valid, but I do think that we haven't lost it, and I think there's an awful lot that's been learned over the last 6 months that will take us into the next 6 months as well. Thank you.
Andrew, are you happy with those responses?
Certainly, Chair. I thought it was important, and Councillor Mosdale has clarified what she said, because I think the wrong message might have gone out there. Good. Certainly, I might contact Joanna if she doesn't mind, and we might explore some of that.
Yeah, please do. Yeah. For anybody that doesn't know, Andrew is also known as Mr. Data, so it's very important that we get this item clear. Thank you very much for that. So I think that now closes this item, and we move on to. Oh yes, Michael. I'm ever so sorry. You made a really common sense proposal, Michael. Would you like to state your proposal so we can vote?
Yes, I've put it through to Paul, so hopefully he's got the wording to help him. I wish to make the following proposal: Health Scrutiny committee wishes to thank the staff in the adult social care and all staff in Isle of Wight home care and residential and nursing home providers for their outstanding work through the COVID-19 crisis. In accordance with health scrutiny inviting to this meeting Isle of Wight voluntary and sector representatives to present and discuss with the committee about their experience during COVID, we invite representatives of Isle of Wight home care, residential and nursing home providers to our next meeting. Right, I'm looking for a seconder.
Right, Andrew seconded that. So, Megan, can you do the round on that?
Yeah. Councillor Cameron.
Councillor, yeah, sure. I support this.
Or.
John?
Or.
For.
Well, that's unanimous on that. Good job. We'll have an informal meeting, I think, first, as we did with other sectors. So really good. So now we'll move on to item C, which is the NHS Trust. Now we've got several people here from the Trust, so I'm not sure who's going to lead, or are we going to fight about it? Silence. So who's leading on this for the Trust, please?
Let's have Maggie.
It's Maggie. We want
John,
Maggie.
I think Maggie was planning to introduce, but she's having some technical issues, so I'm just going to pop into her office and see if we can fix it. If you bear with me a second.
Yeah. Okay. I know Teams can be a bit trying at times.
Chair, if we aren't able to get Maggie, I can happily introduce.
Yeah. Well, do you want to start, Darren, while we're all sat here anyway?
I think so. Can I just check whether we've shared any slides?
Slides. So
yeah. We've got it in the agenda pack.
Yeah.
With the papers, yes.
Paper C, Chairman.
Paper C.
Paper C.
Great people, great place. Yes.
That's the one, Michael.
Yeah,
that's exactly the one, Councillor Levy. Yes,
I've
indeed.
got a presentation to share if you want me to share that. I thought you were having a break, so I'm just getting it up now. Did you want me to share it as I did just now?
Yes, please. Unofficial break. But carry on. Yes, please.
So just bear with me.
Yeah.
Sorry, it's just going a bit slow.
Right. Unfortunately, Maggie's microphone won't go off mute. So it looks like you're possibly you're leading on this then, Darren. Or what about if Kirk's there? Can't Maggie come in on Kirk's microphone?
Shall we go, Chairman, just with the printed copy while we're still...
Yeah, it's working now, Maggie. You're on.
Oh, good. Right. Welcome, Maggie.
Hello.
Yeah, we can all hear you.
I'm not. Apologies. I don't know why. I never normally have any problems with MS Teams. I'm not going to labour about our slides. I'm really pleased that we've been able to attend this evening scrutiny meeting, and I've brought a variety of colleagues with me, more importantly to answer your questions in the most detailed way that we're able. I'm going to take it as read that you have had the opportunity to see the slides, because I know they went out with the packs for you. So without further ado, I'm going to pass to members of my team who will introduce themselves and give you a flavour of the work that they've been doing and our contribution, but I'm very conscious that the value for us will be in your questions, not repeating the slides that you've already read. So Claire, can I hand to you, please?
Thank you, Maggie. Thank you, Chair. So good evening, my name is Claire Gowland, I'm the Deputy Chief Operating Officer, and I'm standing in for Jim Smith, who's our Chief Operating Officer. So following on from Maggie, we'll take the slides as read, but I just want to refer to them as I go through. So responding to COVID has taken a tremendous effort from NHS staff. I think that's probably taken as read. Staff have been incredibly agile and responsive, not only dealing with the initial impact of COVID, but also the continuation of adjusting to varying scenarios. So the challenge has been to remain responsive to the threat of COVID, whilst also making sure that we focus our energies and actions on an effective recovery. The introduction of social distancing, infection prevention and control measures, as well as the changes in our demand, have impacted on performance, but we can go through that a little bit more detail as I go through. In terms of, apologies. So in terms of our operational performance, referring back to slide 4 in the pack, accident and emergency, in terms of our emergency 4-hour access standard, in July we saw 95% of our patients admitted or discharged within 4 hours, and that was the 3rd consecutive month. Towards the end of July, we started to see quite an increase in activity again in the number of patients who are coming through to the ED. And that was sustained throughout August. In terms of referral to treatment, that's been our most challenging area, and it's the combination of actually making sure that patients are seen in outpatients, they have their diagnostics, and also they go on to definitive treatment. In line with the national picture, this remains a challenge, but it's something that we've got a number of actions that we're working towards. Cancer and diagnostics, whilst having a significant impact during the initial COVID phase, have started to see some recovery, certainly last month and again this month too. In terms of the weekly attendances to ED, there was a significant change, and I'm taking you on to the next slide if it's there in your pack in front of you. The bottom graph will show you that by the end of July, we were at in excess of pre-COVID levels in terms of ED attendances. The shift in the types of presentations coming through the front door were quite marked as well. So we have seen an increase in drug and alcohol related attendances, in trauma and in non-COVID respiratory. The hot spell also brought in cardiac and stroke related attendances as well, which had another impact on what we were able to deliver. If I just tell you one of the key messages from the first week of August, we had an average of over 140 trauma related attendances over 3 weeks from July into August. That's a 50% average of 50% increase on the pre-COVID average. Drug and alcohol, we were seeing about a 36% increase. In terms of diagnostics, as you would expect, April and May saw a significant reduction in our ability to manage the number of patients who were requiring MRI scans, CT scans and other diagnostic imaging. That has started to recover, and actually we were back up to about 77-78% in July, having dipped to just under 42% in April, so a good recovery. 3 points in terms of our ambulance service. So if I break it down into 3 different areas, first is the category 1, 2 and 3 and 4 response times. We saw a dip in July, and most of that was around the shift in, or the increase in category 1 and 2 responses. So these are your 999 calls and your high acuity calls. The category 3 and 4 were achieved, and they were the lower acuity patients. In terms of 111 call handling, again, we've seen quite a shift over a period of time. First of all, with a significant increase in calls to the 111 centre. Some of the performance was impacted upon. We weren't answering all our own calls. It was going into a national call centre and being redistributed as well. But we're starting to see improvements there. And the other is the patient transport services. So the biggest impact there was because of social distancing. So again, we ended up with single occupancy vehicles for very obvious reasons. We are now able to make a risk assessment, and for a number of journeys we are able to put 2 appropriate patients back into the same vehicle. So that started to have an improvement in how we manage our patient transport services. I'm going to hand over, and I don't know whether you want to take questions at the end or as we go through, but otherwise
at the end.
Yeah, hand over to Chris Ainsworth from Mental Health Services.
Thanks, Claire. So we should be on slide number 8. So I'm Chris Ainsworth. I'm the Deputy Director for Mental Health and Learning Disabilities and the Head of Psychology and Allied Health Professionals. As kind of Claire mentioned, we've seen a kind of huge response from the Mental Health and Learning Disability team during the COVID period. And they've demonstrated real kind of flexibility in ensuring that kind of services continue and we can continue to meet the needs of the kind of local community. Our kind of activity rates have largely been maintained, and that's through the use of kind of virtual technology and offering remote appointments. We're seeing some referrals now, increase in referrals across the system. And we're kind of putting in additional resources to be able to meet that. So we're kind of anticipating that there will be a surge in mental health referrals as a result of COVID, and the kind of figures that people are talking about are between 20 and 30%. The integrated mental health hub, which we put in place during the COVID period, has been really successful, and that's why we've been able to work with some of our system partners to be kind of co-located and deliver services from one place. We're going to maintain that integrated hub, and that will be part of our mental health service going forwards. So that's been a real kind of positive and a real success. And overall, the kind of performance has been really high in some services. So IAPT and EIP have been able to maintain their targets despite everything that we've had to deal with for the COVID period. So I'm going to hand over to Alice, who will talk through the next slide on community performance.
Thank you, Chris. So I think we've talked a lot around community and the community provision in the wider system, but this is a specific slide for the NHS community division. And I think it's probably just worth mentioning that in July, we saw an increase in activity, and often people don't realise the quantity of contacts we're having per month. You can see in this slide it went up from 13,421 in June to 14,347. That's across the whole of the division. So we do have a huge number of contacts with people in their own home, either receiving reablement, rehab or community nursing. Those are just a few of the services. We do have a small community unit that you can see is mentioned there. The bed occupancy was lower because we didn't have all the beds open, because we had spare beds, we had empty beds in the acute, and we also had empty beds within care home provision. But I think for the community unit, one of the things we're really keen on is that people are enabled to go home to their own environments, and we are using some data by ULIS, who are working through a few key performance indicators, and actually it's really important that patients are working towards home, and 97% of patients were up, out and dressed every day when they were within the community unit, and that meant that their average length of stay was lower, but they were also able to return to their original destination, which has been quite a change for us within the community. Integrated discharge team I won't talk about, because I know that Mark has already spoken eloquently about how we speeded up the process for discharge within the island, so I'm happy to take the next slide. The next slide is for me with my Director of Nursing hat on, and apologies, I realise now I didn't introduce myself. So Alice Webb's the Director of Nursing, Midwifery, AHPs and Community Services. Previous slide was Director of Community Services, this one is as Director of Nursing for the organisation. So part of the process that we're going through at the moment is around the quality improvements that we want to undertake within the whole organisation, and clearly that's going to make a difference to our island population. As a result of the CQC, when they came in and have done their visits, we've been working towards a plan, and what we are stepping up since COVID is how we're reporting this and managing the process of quality improvement. I won't read the slides, but you can see here what we're asking each of the divisions to do is to identify what their key improvements have been month on month, so that we've got evidence of it. And again, many people have spoken about that as we've gone through the presentations. Next slide, please. What we also get people to do within the divisions is to not only look at what they have done, but look at what they are going to be doing. And then the following month we'll check and just confirm that some of those improvements have been made. So as you can see here, we're absolutely looking across the organisation to confirm that we continue to deliver the high quality care that we want to and that we aspire to. And I think it's really easy just to pick out a few points. I would go to the community. I'll start from the left hand back to the community where we talk about technology enabled care. We have really stepped up over the COVID period the technology enabled care that we have delivered, both within the NHS but also into the wider section, and have worked really collaboratively with our care home providers to ensure that we can deliver technology enabled care, whether it be tele-swallowing, ordinary observations, telepodiatry, but really capitalising on that. And we're certainly working with our acute colleagues now around Attend Anywhere and having virtual appointments, which has been really successful, and patients have really enjoyed it. As part of that also, we've worked with safeguarding, and we are delivering a number of sessions around safeguarding for our younger clients who absolutely love technology. They are far better, they always say ask a teenager, and they are engaging much more proactively with some of that. If we move to the next slide, please. Just to summarise, really, we are hoping that the CQC will come in and see the improvements that we've made. We don't have a date for them to come, and they are changing nationally. They're changing as a response to COVID, the way in which they inspect and will review a trust. So we continue to have dedicated quality improvement, communications support is in place, and it's going to be really important that as some of this we focus on the successes we've had. And I would have to say that those successes are absolutely as a result of some of the integrated way in which we're working both with our local authority and with the CCG primary care networks in really looking at how we sustainably deliver care across the system. Thank you.
Okay. My name's Nikki Turner, I'm the Director of Transformation. I'm just going to walk you through a few slides on partnerships that are with our colleagues, mainland trusts. Just wanted to say that during the COVID period, we did find that we had some partnerships that did pause, others that continued working, and I'll give you a bit of a flavour of that. Apologies. Give you a flavour of that through the ambulance partnership. Could you go to the next slide for me, Kirk? Right, so if you look on the right hand side, you will actually see, and you mentioned earlier, Claire talked about the fact that we have improved our ambulance performance. If you actually compare 2018 to 2020, there is a significant improvements across all our categories, all our performance. So what I would say is that the ambulance partnership is quite a mature partnership, and certainly during COVID, what we actually found was we continued that partnership to the point where actually, as an island, we were supporting SCAS. We asked them actually, what can we do to help? How can we help you? We actually invested in a number of additional call handlers on the Isle of Wight, which was fantastic, and they have been and will continue to support not only through the COVID period but certainly within winter. One of our key focuses with the ambulance service has been the improvements around our IT, our infrastructure, and what we've done is align our IT systems with SCAS. You would have heard in the past, 12 months ago, we talked about the 999 CAD and rolling that out. That's the computer aided dispatch system. We're actually in the phase of actually rolling out SCAS's PTS version as well. And what that will enable us to do is actually plan not only our mainland transfers, but also transfers back to the island. And we aim to actually smooth, I suppose, our assessment and our moving of patients between our partners to make it as smooth as possible. What I'd also say is, you've probably seen through some of our presentations to Trust Board, is our wider partnerships. I mentioned hover travel and the absolutely outstanding work during the COVID period, and the fact that we can still and are transferring patients off island through that route, and our mainland partners, i.e. South Central Ambulance Service, are picking patients up. What that means to the island is actually we get our staff back onto the island, and we're able to deploy those ambulances far quicker than we would have been with actually taking them completely off the island for several hours a day. If we could move on, Kirk, to the acute partnership. So this is one that did pause, but what I've been really pleased to see is actually in the last probably 6 to 8 weeks how quickly we've picked back up. The really important thing around this partnership is the learning that's come out of COVID for both partners, and the fact that we have actually taken that forward together and said, actually, do we need to do anything differently? How do we work across our population of 800,000? What are we going to do differently? And during that period, we have actually developed a joint clinical strategy, and our focus is going to be around core emergency services over the next 12 months. I think, John, you might have had a question around our relationship with Portsmouth and how that's benefited us. What I would say in particular is, whether it's this partnership or other partnerships, it's really about how we plan services together, how we look at actually the fact that the wider NHS ourselves have significant challenges to tackle, and how we do that together. You've heard from us in the past around recruitment and retention being a challenge. We are certainly looking with our partners to say, how do we do that jointly together? How do we look at joint posts? And we know we have a new joint chair with Portsmouth in place. So we are looking at recruiting together. We have looked at how we train together, how we develop posts together, and we've had really positive feedback during the COVID period around support, particularly for specialist advice out of hours, which has been excellent with our partners in Portsmouth. We're also looking at how we develop our skills long term, and how we look at that training. Do we create new posts as well? So it's quite an exciting period of time moving forward for us. If we could have the next slide. I'm just going to pass over to Chris, who you heard from earlier, just to talk about the mental health partnership.
Thanks, Nikki. So the mental health and learning disability partnership with Solent remains really strong. And just last week, we had a live event which was really positive and really well attended, with over 80, a mixture of kind of service users and stakeholders, where we talked about the kind of partnership and some of the transformation work that we've put in place over the last few months. We're working with Solent and other local system partners on redesigning the service with a new model which is emerging based on the philosophy of no wrong door. And this has, again, had significant engagement with users of our service and other stakeholders as well. The new model is going to be about locality working, with more complex presentations being coordinated centrally, but still being delivered island-wide where possible. And the integrated model will kind of strengthen the community services and reduce the reliance on acute inpatient beds. So the partnership with Solent, with the CCG, with primary care and with the third sector are all coming together to help develop and to deliver the next phase of this transformation. If we can move on to the next slide for the community, thank you.
Alice, would you like to pick up?
Certainly can do so, thank you. This is in its infancy compared to the other partnerships, but we have done a partnership prospectus that has now gone out to providers to look at getting a strategic partner for us. The expressions of interest will be all due in today, and I think it's fair to say that we're making progress with it, but we are not as advanced as the other areas, but I'm happy to take any questions towards the end regarding that.
Thank you, Alice. So we're just going to hand over now to Darren about investing in our future.
Thanks, Nikki. So we've got a couple of slides in here. I'm really pleased and really excited to be here this evening in front of the Health Over and Scrutiny Committee to talk about something we're calling investing in our future. Those of you that are aware, we received approval to spend up to £48 million on delivering our strategy. So central government funding through the Department of Health and the Treasury in investing in the delivery of our strategy. So our partnership, as others have talked about, strategy rather, as others have talked about, are partnerships. We have some emerging and existing partnerships, not least of which on the island. And that £48 million is going to be focused on a few things. I'll talk about those in briefly now. Investing in the improvements at St Mary's, investing in our community to improve the experience and make much more of our existing and future resources. Developments over at Portsmouth in terms of a population that travel for complex clinical activity, and really importantly, and it's been touched on a few times already this evening, is an investment in our digital platform. So that's our infrastructure as well as the clinical systems that support our clinicians when they're receiving and providing care, and devices. So Alice has talked about our technology-enabled care in our care homes and other community settings. So it's devices as well. And we're all used to using technology, aren't we? But we don't always do that particularly well in either health or even potentially other parts of the system. So what are we going to do? The next slide, which you can see there, how are we going to spend that money? On the St Mary's site, emergency care floor, so co-locating all our emergency services, so there's a seamless pathway for patients to not only improve both the care but the experience whilst they're with us, and also an integrated high dependency unit, so that will also co-locate our ITU as well as that HDU. I won't go through all of those other than picking up perhaps a couple of others. The community health and wellbeing hubs, really important for Ireland, integrated services. We've all talked about how we've worked together really well, and we need to continue to do that, and having an investment in those community health and wellbeing hubs is going to be critically important for us. And I won't go through digital and ambulance integration. The last slide is for you governance people out there, and what are we going to do quite quickly? There's a whole process here that we'll need to go through. And what I would propose through you, Chairman, is that I and others come back on a regular basis to update on where we are and what we're doing and investing in our community. This is about investing in our community and our acute and other services to improve our patient care, our offering and the experience of patients. But it will be quite a long programme. It will take up to 3.5 years to complete. So by 2024, this programme will be complete. I'm conscious that there are bound to be lots of questions from that, but really exciting and really a good opportunity for us to work together going forward. Thank you.
Thank you. Well, this is a million miles from the NHS Trust of just a short time ago. It's really fantastic and so positive. I'm so impressed, Nikki, with your ability to anticipate my questions. I really don't know how you managed to get into my head like that, but maybe I'm just too familiar with all those trust meetings that I attended. And on that point, it's just, I think this committee would like to formally thank and appreciate Vaughan Thomas, who's retiring on the 4th of October, for the excellent chairmanship he's conducted for the trust. I think that what Vaughan has achieved is quite remarkable, and I've certainly learned an awful lot from him, and will continue to do so from my few conversations with him and the way I've observed him operate. So can we take that as a formal vote of appreciation from the committee for Vaughan's excellent work?
I second that.
Thank you, Michael. Now we've got a couple of people who would like to ask questions, and the first one is Joanna.
Hi, thank you. So it's more of a very quick comment, really. So we've been pretty challenging historically around mental health services. But I'd just like to say I attended the live event last week, and I've spoken to people that use services, and the changes that are planned are really impressive, and the huge amount of work that's been done around mental health services, which was sorely needed, has been impressive, and much of it is focused around talking to patients, talking to people that have used services historically, and that is clearly evidenced in the plans, because particularly the rehab plans are really innovative, and they're actually giving people and patients what they want in order to get better and have a recovery from mental health. So yeah, just a really positive comment, and I'd like to say that I'm really impressed so far with the plans for mental health, and the fact that you've worked so hard at talking to service users and patients, and I really hope this continues.
Thank you, Joanna. Kirk informs me that there are actually some more slides, so sorry about that, Kirk. So carry on, please, and then we'll go to Michael.
Thank you so much. And this is really just, as it says, about our recovery and our way forward. So looking at both outpatients, inpatients, diagnostics, and actually how we manage to continue our responsiveness to COVID, but also recover our services. It's fair to say that there's been an increase in waiting time for outpatients appointments, but there's some really good progress is being made. It's going to take some time to clear the backlog. The most important thing is that we communicate with our patients, that we make sure that they understand exactly that they haven't been forgotten, what the options are for them, and the timescales involved. So that work is ongoing. We continue to increase the use of virtual outpatients appointments. We've got a main outpatients department that's now reopened, which means that we've been able to expand our waiting areas to allow for social distancing and a very clear one-way system and new drop-off and parking. And we're at 91% of normal activity levels in outpatients at the moment, and that continues to increase. We can go to the next slide, please. This takes us through to our inpatients and day surgery. And we know that in line with so many organisations that there will be some people that will wait more than 12 months for their procedure. Obviously, we feel that as much as those out in the community do as well. We are assuring all our patients that people are going to be prioritised by clinical order, and those lists are constantly reviewed by clinicians to ensure that we are responsive to those in most need. We've undertaken a review on all patients with extended waiting times, And as we've said before, the three biggest impacts really are the social distancing, the infection prevention and control measures, and also maintaining the COVID and the non-COVID flows that have impacted significantly on how we do things. The use of the independent sector is going to be an important part of our recovery process as well. Next slide, please. Diagnostics, so routine scanning was suspended across the country. You can imagine the sort of impact that caused for us. Direct referrals from GP reduced considerably. They've started to pick up now, and we have significant backlogs for MRI, CT and ultrasound. We're back to pre-COVID levels of referrals now. Scanning capacity is similar to theatres in the way that it's been impacted on through the infection control measures and the flows, as I said earlier. And then we continue to manage the backlogs and keep in touch with our patients to ensure that they know exactly what's happening in terms of waiting times. We could just go on to the final slide. So our current capacity sits at approximately 80% across theatres, endoscopy, CT and MRI, and that just gives a breakdown of those different areas and tells you or explains a little bit more about where we've had the impact on activity capacity. And the last one, so very briefly, use of the private sector is key. Extending our theatre days will help provide some additional capacity and reduce our waiting times. There's potential to bring in clinical teams also to operate in our theatres over the weekend, which will help us to create some additional capacity. Potential for a third MRI scanner in January 2021 to enable the backlog to be cleared by March. And also a third CT scanner, potentially November 20th is the aim. And again, by the end of the financial year, we would look to be clearing the backlog of CT scanning as well. The most important takeaway, I think, from this is that we are in constant communication with our patients, and clinical prioritisation is absolutely key to every step. Last slide, I think.
Thank you, Claire. And yeah, it is the last slide, and then we'll be very happy to take questions. And John, you've alluded to this already. I just wanted to update members on our chair. So, oh, the slide's disappeared, sorry. I wanted to update you on the appointment of our chair. Vaughan Thomas, as you've outlined, John has now will be stepping down on the 4th of October. He was appointed for a 3-year tenure, which is up on that date. And he's always made it known that he would not be renewing or asking to renew that appointment. So I again echo your kind words, John, around the thanks that I would like to place on record for the support that Vaughan has given us. We said some of this at our trust board last week. The challenge and the determination to see our services improve has been driven by our chair. And I'm really grateful for the support that he's given us all. NHS England and Improvement are responsible for the appointment of chair. Some of you will remember the process from when Eve Richardson left us and Vaughan was appointed. They've been through their appointments process, and they confirmed a few weeks ago now that Melanie Poole will be taking over as the Trust new chair, and her start date is October the 5th. As I've said in the slide, Melanie's got very extensive NHS leadership experience, and we are all looking forward to her joining us. Melanie will also continue as the chair of Portsmouth Hospital Trust, and she will chair both of the boards, but our boards will remain as sovereign organisations. I feel it's very good news for the partnership, for the acute partnership with Portsmouth, as it obviously with Melanie being over the 2 trusts, she will be able to ensure that as much as it's my #1 priority, to ensure that our acute services have a bigger NHS organisation to work with. I do feel that we will also have the support from Melanie as well to help drive some of the changes that we need to make. So that's all of the conclusion of our slides, John, and we're all very happy to take questions.
Yes, Maggie, and also to note that that my comments on in appreciation of the board are echoed from other partners present at this meeting as well. So, Michael, you're next in line. You had a question.
Tonight, I've then got a proposal at the end of this.
Yes.
I would like to actually go on the back of what Joanna has said and actually say, as you know, I've always been a very strong advocate on mental health, and I haven't been frightened to come forward with very strong criticism. I actually do see on the ground that there is a move in the right direction in mental health, and I would like to officially say that. I'm going to put forward a proposal to suggest that there is a separate informal meeting with the Scrutiny Committee on mental health, because we've had them before. We've had special working groups on this, on suicide prevention. So I think it would be a good opportunity with yourself and the CCG to, I think, get updated and to see how we can support, to go forward. But I do wish to say it's been an overall excellent report, and I have seen on the ground that there's a side. I particularly, with my involvement with the Isle of Wight Youth Trust, think that the partnership and collaboration work with the NHS Trust, with Bernardo's, is the way forward. And I'm glad that we can actually start to see some very, very positive dialogues coming forward. I would like to highlight on your report page C17, which is on the mental health, that you actually do make about locality teams. And I would like to highlight that at the beginning of this meeting, you got the report from the voluntary sector and how the community response, the 26 community response teams in the localities worked incredibly well, and actually were working with your mental health hubs in actually, providing telephone support at first level and escalating up. And I just think that, can you add that to your, when you're getting the localities, that she take advantage of the development of those community hubs at level, and also the participation of town and parish councils, who are actually in a better position to fund local activity than actually the Isle of Wight Council is in a lot of ways. So, and they also tap into, obviously, lottery money and other sources of funding. So I think that there is a discussion there that comes out of actually the work that has been done. My last particular comment is to highlight about hover travel. I am a Ryde councillor, I'm the mayor of Ryde, and I have seen for myself the terrific work with the NHS Trust and hover travel, and I was glad that you publicly raised that, and I wish that we can minute that hover travel went beyond the line of duty in lots of ways in working with your teams, and as one of the operators who didn't stop their services right through, I do think we need to note that, and I think there's a good partnership there in the future.
Yeah, good.
Thanks, Michael. May I, John?
Yes.
I've put some comments in the chat box, but
Yes.
The feedback from Councillor Lilly is very much appreciated. Again, I'd say you have challenged and encouraged and supported us throughout the last few years, and we may have had very difficult conversations several years ago, but your support has meant a lot to us. We will be delighted to attend a mental health and learning disabilities specific meeting. And I also just want to echo the comments that you've made about hover travel. They have been really superb in the way that they have worked with us, and they have made a great difference to many of our island residents in the way that they've been able to offer us transport to the mainland. So I know that Dr. Stevens, if she was with us this evening, unfortunately she wasn't able to attend, she would have been delighted to hear your comments, and I'm sure Chris will feed them back for us.
Yes, please send her my best wishes. Thank you.
Great. Thank you for that. And Michael is, as somebody once described, an ex-professional pro, if ever there was one. So thank you for that. We've got Andrew wants to ask a question now.
Thank you, Chair. First comment, but I very much look forward, now I'm a member of your committee, of supporting the work somebody referred to about the importance of the governance structures that will need to be developed to oversee this, to be that critical friend who is and challenging to make sure that things are indeed on track, and exploring those reasons why not. One particular question I do have, and I may have missed it, but in these virtual calls are sometimes difficult to kind of make sure you've heard everything, but under the mitigation, it refers to a number of the plans requiring financial approval, and currently those are being considered. What's Plan B? What sort of impact does it have if some of these plans don't get the financial approval that's being sought?
Darren, do you want to answer that?
Thank you, Maggie. Yeah, really good question there, Andrew. We took a paper to our Trust Board last week, and the board were unanimous in their decision, which is our patient comes first, and therefore we decided that we would need to invest that money, and we would potentially have a difficult conversation with our regulators about the financial impact of that, as opposed to worry about not being able to treat the patients. So our plan B is a difficult conversation with our regulators.
I think, John,
thank you.
If I could also, Andrew, again, I think it is a really good question, and no doubt in the future I will come particularly and ask for your support. We believe we're doing, our board agreed last week on Thursday that we're doing all of the right things for our community. As we've outlined in some of the slides that we've presented earlier this evening, we were instructed by the government and by NHS E&I to take certain action during the course of the first wave. No doubt if we get into a wave 2, we will be instructed to do things then. Without a doubt, it's impacted on those who are waiting for elective treatments, and many of our elective treatments go on to be of a serious nature. We're very, very conscious of that, and we know that the actions that we've agreed at Trust Board will alleviate some of the long waits that have now built up during the course of the spring and early summer. Undoubtedly it will affect our financial position, but I think rather, I know that some of the councillors who've been on this committee a long time felt that our predecessors weren't very upfront and transparent around the deterioration of our finances. Undoubtedly, if we do not get financial support from our regulators, we will have to carry some of these costs ourselves. And I would like in future months to be able to say to you, we prepared you for the risk that what we believe is doing the right thing may have a negative impact on our financial position as we get through the winter and into next spring.
Thank you, Maggie.
Sorry, can I?
Just before you put your proposal, Michael, which was again a very wordy one, was it a question you wanted to ask, Michael?
I just wanted to ask Maggie, we talked about a letter regarding testing and using our authority as a scrutiny committee previously. I would like to ask Maggie, would a letter of support from this scrutiny committee to your regulators highlighting that we as a scrutiny committee feel that you're in the right direction, and that we would very much support the need to continue the funding with that? Perhaps you could help us with the wording, Maggie, but would you value that?
I mean, I think it would be helpful, and I think that we could work with perhaps John and Darren could. I think John, difficult when you're on MS Teams. I couldn't see if you were on the trust board with us last week, but I know you will have heard some of the discussions around what we need to do. But perhaps Darren could work with you, John, on some words that would be very supportive and helpful.
Yes, yes. I think that's an excellent idea. I'm not sure that we need to go to the vote on that, because I think, you know, anything to support. But yeah, heads nodding. Now, Andrew wanted to ask another question. Andrew.
Yes, if I may, Chair. There's been a lot of commentary, of course, about hidden impacts of what the pandemic's done, and that we'll be seeing diseases and conditions emerging in states that are worse than they may have been had there been no pandemic and people just going through the health system in the usual way. Just wondering what work is being done on the kind of horizon scanning of that. So what is going to be needed in place potentially 5 to 10 years from now to deal with this cohort of people who will be coming through, potentially with much more serious conditions than they might otherwise have had.
So if I'll kick us off, but it may be that Claire and Alice and Chris want to say something. If I kick us off with, I was on a call with our National Director for Mental Health and Learning Disabilities, Claire Murdoch, a couple of weeks ago. And one of the things that Claire has tasked us with doing is looking from a mental health perspective to see what activity did we stop seeing during the COVID wave 1 because we were restricting access to services, and what requests are we seeing now? So does it match? This is what we would have expected to see if we hadn't have had wave 1, or have we got a growth that's more significant than that? And that will help us from a mental health perspective answer that question when we've had the opportunity to look at some of that data. I think, again, in relation to your question in relation to acute services, we know, and you know, you may have heard me when I went on the radio a few times, and I've certainly said it here at this forum, we encourage people throughout the pandemic wave 1 to still come forward if they needed our emergency treatments. But we were cited on several instances of people being at home for too long with cardiac symptoms and with the early symptoms of cancer. Now, again, we await to see what when we open the gates, as Claire's described, with bringing more of the diagnostic and outpatients work in, we will again be able to answer some of those questions. But Claire, Alice and Chris, I don't know if you'd like to add anything to that.
Darren?
I don't know whether Simon, apologies. Can everybody hear me? Sorry.
Yeah.
Yes, yeah. Thank you. Yeah, I don't know whether Simon's still with us, but I think it's a fantastic question for the longer term view from a public health perspective, not perhaps for this evening, but as we move forward, Andrew, that's where we should be heading. So what are the needs in 5 or 10 years time that we can plan now to respond to that? I don't think we can do it justice this evening, but it's a great question. We'll need to come back to it.
Yeah.
Yeah, okay. So Mark Howell, you wanted to ask a question. Yes, Mark.
Yes, I did. It's really, I suppose it's a question and endorsement, really. I've already mentioned it on the chat, but I think it's not to forget, I suppose, that there are already a lot of things in place through the COVID-19 has almost transformed a lot of things that we've done in a collaborative manner. And I think that what I would say in terms of the wellbeing hub, which is amazing, if we could get those hubs established in different parts of the island. We've got the barracks, we've got Ryde as well, health centre we're looking at placing, and we've already got social workers in those areas as an integrated offer with mental health, but also with therapy, with district nursing, linking it into primary care. But also, let's not forget the police, let's not forget fire. It is a real opportunity. But what I'm saying, I suppose, Darren, is we've already been building that. So this is an opportunity, and listening to these plans and these potential investments gives us a real opportunity for the people on this island, and that's the bit that counts for me, making that difference. So this is very good news that I'm hearing in terms of what's been presented. So thank you very much, Dan.
Thank you for that, Mark. Now, before we move to Michael's proposal, it would be remiss not to raise a question that is inevitably on many people's minds, as it often is when it concerns the Isle of Wight and our unique position, and that is, Maggie, what assurance can you give to people that are suspicious and raise these sort of questions that the new association with Portsmouth is not some ploy to sell us down the river and have the Isle of Wight taken over? So, I mean, it might sound a little bit silly and flippant, but it is a very real question from certain people, and it comes up time and time again whenever we're faced with partnering with the mainland.
Thank you. Thanks, John. And I just take this opportunity to be really clear, in case I wasn't when I mentioned this earlier. I want to say, firstly, this is not a joint chair over bringing two trusts together. This is a chair that will be chair of Portsmouth Trust and chair of the Isle of Wight NHS Trust. We will continue to have our sovereign boards. I will remain as chief exec here on the Isle of Wight, and my colleague Mark Cubban will remain as the chief exec over Portsmouth. And all the colleagues that are here on this meeting tonight will continue in their posts. It will give us the opportunity to work, as I have spoken here before about the partnership model came from our health and care plan, and you will know that we're 18 months into the delivery of that plan. I'm not going to repeat here tonight all of the reasons why we three leaders, three organisations came to the conclusion that we needed to have partner organisations to support us. But they're all around the place we were when I first came here 3.5 years ago. I'll remind you, we had 9 services inadequate for patient safety when I first got here. It was a very dire place for us to be. When we did our own analysis, that's the local authority, ourselves and the CCG, we were clear that many of our problems stemmed from the scale and the size of the services that we run. I've given you before the example of our Skiboo, for example, the special care baby unit. I'm very proud of the improvements that they've made there, but often there are no babies in that unit, partly because of the improvements that we've made to maternal health, but also partly because of the age demographic of our island. We still carry the overheads for that unit 24/7, and we still have to ensure that the staff receive adequate training and exposure to the most serious of conditions that our newborn babies might face. So we do need to ensure that we've got an NHS partner that we can work with to surefoot all of our services. Now I'm going to pass to Nikki, because somebody else asked Nikki this question very recently, and I thought she answered it extremely well. So Nikki, I know you explained this in a very simple way the other day, so over to you. You're on mute, Nikki.
And
that's it. No.
You're there, Nikki, now.
Am I now?
Yeah.
Yes.
Okay, so it's saying I'm on mute, so apologies. I think my computer's confused. Thank you, Maggie, for saying I said that so eloquently. I think that the important thing for us is the fact that we have a huge opportunity to look at a population size of 800,000, to look at creating joint services, which means that we can, for example, stroke is a really good example. We know on the island that we do struggle with trying to recruit staff, but we know if we work collaboratively together, we can actually produce some fantastic models of care for our patients that not only just serve the Isle of Wight, but serve our Portsmouth colleagues as well. So there's lots of opportunity for us here, and I think through the partnerships, it's not just about one partnership here, and I do hear you, John, talking about Portsmouth, but actually it's the working of those partnerships across. So if I give the example of transferring patients, I mentioned hover travel earlier, I think that actually we have to work not only with Portsmouth, we have to work with SCAS as well to make sure actually we do timely transfers and we use the best of all of our resources and don't find ourselves in a situation where we have our patients or our staff actually spending more time on the mainland than actually on the island where we actually need them. I don't know if you wanted to add anything further, Maggie.
No, I only to repeat really what I've said. We will continue to have the Isle of Wight NHS Trust here on the island. We will work differently with our partners. Now, if I refer you back to the health and care plan, can't remember which page it was on, but we did say in the health and care plan back 18 months ago that we would have to see what was the success of the partnerships, what could they deliver, and what further work we would need to do with them. We agreed at our trust board last week that we would now, our executive team will start to, with the ICP colleagues, look at what the health and care plan needs to look like in years 4 and 5 and onwards, and we will update you if we feel that there is any developments with the partnerships. But I can tell you, and I'm sure John and others, you will get to meet Melanie if you haven't done already, but she's joining us to drive the improvements that we need to make, not because she sees the Isle of Wight NHS Trust disappearing anytime soon or even ever in the future.
Yes, I don't think you have to convince anybody here, Maggie, but nevertheless, you know, out on the street, it is a real fear that that could quite easily be allayed. And I just wondered if I might suggest that with the ever capable Kirk, we could look at some sort of form of very simple, clear communication, notifying people of the benefits and of the new arrangements and why they shouldn't be frightened of it. So on that, let's go to Michael's proposal.
Just before I make my proposal, John, I would like to come on that and particularly say I'm a particular councillor that's quite island centric quite often. What we want is the best for our community and our residents, and the reality in the past was because of recruitment and expertise, right? We needed a relationship with a level of something that Portsmouth provides that's linked to, you know, a university hospital, linked to a university that can provide at you know, a day's notice or an hour's notice, the high level of expertise to actually make them well again, right? Much more efficiently. And I therefore welcome that we have that partnership now and forward, because from a health scrutiny point of view, we want the best for residents. And I think this is a practical move that provides that. So I fully support it. My proposal is, Chair, is I wish to make the following proposal. The Health Scrutiny Committee thanks all the Isle of Wight Trust for their dedication and hard work during the COVID crisis. And we particularly highlight thanks to Hover Travel and their close working with the Isle of Wight NHS. And in regard to mental health, I propose an informal meeting with the Trust and CCG to get an update on the mental health and look at some of the data and the information that Councillor Garrett raised, particularly around trauma and also suicide prevention. I would want within that. So that's my proposal. May I have a seconder?
George, and George. Can we get
yes, Chair, if we can include learning difficulties.
Okay, mental health and learning difficulties, yeah.
Thank you. Thank you.
Okay, Megan.
Okay, Councillor Cameron.
George, you're going to say yes? Yeah.
Yes.
Yes.
Garrett.
Andrew.
Or
Councillor Howe.
John. John Howe, Councillor Howe. Your vote, please. Take Michael's vote.
For.
For. Yeah, John was bound to vote for it as well. So, well, thank you very much for a really informative session there and some good outcomes. So, last but by far not least is the CCG. Alison.
Hello there. Apologies you didn't get a presentation from us. I had a few difficulties last week, so I couldn't get that done. I thought I'd just pick up on some of the questions and start with the voluntary one, as we had queries about that, or an update about that earlier. Currently, the CCG holds 17 contracts with the voluntary sector across the island. Sorry, I'm not quite sure what's going on. If I could ask people to go on mute so we don't get the feedback, would that be helpful? So I can continue. So we currently hold 17 contracts with the voluntary sector across the island. And of course, we've been very supportive of the actions that have been taken as we respond to the COVID pandemic, and have supported where we can in terms of voluntary support as we respond to that pandemic. Where we go from here, I'm not entirely sure. We of course have those contracts that we continue to monitor and oversee, and they are considered as part of our business as usual workload, and we would be open to receiving any further ones as we go forward to continue to provide care for the island community. I just wanted to share with you also, because there was a query around the GP surgeries being open, and I just wanted to share with you some data which I will back up in an email to this group, just so that we're really clear about the numbers. Currently, from our data, which we collect on a weekly basis, we have 4,000 people who are spoken to by phone every week. We have 1,100 e-consultation inquiries that are dealt with every week. We have 6,000 people who are seen face-to-face every week. And we have 100 video consultations that are continued every week. And in the region of 180 to 190 people who are seen in their own home every week. So the suggestion that our GP surgeries are closed, I think with those numbers make it really clear that the GP surgeries aren't closed. Yes, they are triaging. Yes, they are redirecting to the right person for that individual's care. And yes, they are seeing people who need to be seen face to face. However, as with all other businesses, the numbers of people that they can have entering their building, the flow through the building as they try and protect their staff and others is really important. So they do have to manage the flow through the GP surgeries. And what we have found is that quite a large number of people actually prefer to be seen either by video or over the phone, because it's much more immediate and they're not having to wait in the same way that they were before. So I'll just pause there and see if there's any questions or comments about those two items before I move on to the other ones, John, if that's okay.
Yeah, that's fine, Alison. Have we got any questions? I don't think so, Alison.
I'll move on then in the fullness of time. James has joined us to give us an update. I wonder if this would be a good time to bring James in
Please
to
do.
the proceedings.
Welcome, James. Nice to see you.
Hi, good evening, everyone. Yeah, nice to see you all. So I just wanted to briefly talk about the mental health rehabilitation business case, which we came to give you a private briefing session on earlier in the year about the progress in that journey. And it was to remind you, in terms of Michael's proposition that we should have a private briefing session, we actually do have one booked for the 30th of September. And that was to give you a bit of an update and a detailed walkthrough where we've got to with the partnership working with Solent over at the whole mental health transformation piece, and specifically to talk about where we got to with the rehabilitation work around Woodlands. Now, the principal proposal around woodlands, which is at the heart of our change programme, would be to move from a CQC registered ward for 10 beds to change it to a deregistered rehabilitation unit, which would move to a more community-based service. This would enable us to move towards a more community-based service and help us with our acute reconfiguration. However, it is a formal role of Scrutiny to endorse the change from deregistration. We're not yet ready to do that tonight, but the request is that we go through that in detail on the 30th, that the Scrutiny Committee would be in a position or agree to take Chair's action to agree to that deregistration, pending a presentation of the detailed business case at your next meeting. The reason why we need to do it sooner is it will take us 6 months to go through that change programme to change the unit, and we would like to go live with that change from April and not push back further after many delays around the mental health reconfiguration work, the process of moving to change over that time. So John, that's the highlights. I mean, I could go through, I provide some slides which went through the background for that work, the way that we've worked with co-production with service users, but I think that's already been referenced tonight, so I'll probably leave it at that point with that request. I think the
information you've given is very succinct, so I think we're there. What we'd like to do is we would like to formally, and I'm making a proposal here, to formally support the Hampshire and Isle of Wight CCG reform. So I think, can I have a seconder on that?
Paper D,
On paper D. Yeah, George. So, okay, and John Howes put his hand up on that. You would take a formal vote on that. So, Megan, if you would like to.
Yes, Councillor Cameron.
I agree.
Councillor Garrett.
Abstain.
Councillor Howe.
John? I don't know what's happening there. Can you put your hand up, John, if you're a for? Yeah, okay. And yeah.
I'm for, but I still would like further information
okay.
within it. So it's a sort of for, on condition we also get some further information.
Oh, that's fine. That's fine. We're going to have a formal meeting.
Okay.
Yeah. Okay. Yes, for.
Then are you happy with what Mr. Seaward's saying about the informal presentation on the 30th of September about mental health pathway?
Yeah. Are we all happy with that? I think we are with the
John
presentation on the 30th. Yes, Alison.
John, could I suggest that we try and align that with the trust, so we do one meeting, everyone together,
please,
rather
please,
than
Alison.
So
can we leave that with you, the trust, and Paul and Megan to resolve? Yes, that's very good. Okay.
Sorry, just to confirm, that is something jointly with Leslie Stevens, who can be here tonight, so we're planning it together. So
good.
Yeah, it's up on earlier in the meeting, James.
We're there already. Yeah.
Good.
Good.
Sorry, can I just say, John, obviously it's important because we've actually tracked for many years the position of woodlands particularly, and I think it's important that we, you know, fight. One of the things that we did at a previous meeting was we welcomed the radical change that was being proposed. So it's important that we actually finish what we started within that, and so I welcome that meeting on the 30th to discuss that. Huh?
Good. Thank you, Michael. That means something. Okay, so we're coming to the end of the meeting.
Is there anything else on the recovery plan?
Is there anything else on the recovery plan that we need to discuss?
I think from our perspective, the trust presentation actually outlines the significant elements of the recovery plan. So I'm happy with that, if you're happy with that.
No, yeah, absolutely. Yeah, it was a very full presentation. So
can I make a suggestion, Chair, that at the next scrutiny meeting, the Isle of Wight CCG can go first, so they've got a benefit of having a bit more time.
Not having their thunder stolen from them.
No, I just want to that's really kind of you, but we are working in a very collaborative way. There's no new news here, so where it comes from is really, we know we're working together on this, but behind the scenes, so who presents it is not the critical piece.
No,
so
Alison has contributed throughout the meeting as well, and thank you for doing so. So
I'm sorry to bother you, Chairman. Can I just request? I have another meeting. Can I leave your meeting now?
By all means, John. Yeah, we're at the end anyway. Thank you.
Thank you very much for everything. Thank you, fellow members, etc., and all people from the Trust. We're all working hard, and I do believe you've all got the Isle of Wight in hand, and I'm sure it's all going to work out fine for you guys. It's everybody. Thank you. Mr. Garrett, thank you for you as well. Cheers.
Bye.
Right. So I think at this stage we can just note our work plan. And can I say that members of the committee and partners can contribute to our work plan. Please feel free if you want to make any suggestions. You know, we have a very constructive relationship with everybody, a very proactive relationship. So, you know, the door's always open between us. So I think we just note the work plan. And that just leaves members' question time. Is there any other questions that anybody wants to make, because we've received nothing in writing? Right, so on closing, people might wonder why it appears that I have a pint of beer over my right shoulder. Well, nothing of the sort. It's the light playing tricks with the council chamber door and the cream head over it.
Good night.
Good night. And on that,
thank you very much.
Good night. Thank you very much to everybody.
Thank you. Good night. Good night.
I think we have to get Michael lamp or something.